Hello. Do you want to know how to improve your sleep quality and quantity? Well, I'm Dr. Vicky Cleak, a consultant general adult psychiatrist, and I'm going to tell you what good sleep hygiene looks like. We often underestimate how vital good sleep really is. Deterioration on our ability to sleep can happen with old age as our pineal gland becomes less effective at producing melatonin. Chronic insomnia can happen with issues such as sleep apnea and ADHD, and sudden onset insomnia may be the first sign of a depression, anxiety, menopause, or a whole host of other issues. So having great sleep is one of the strongest indicators of good health and is a foundation for both mental and physical health. It is literally rejuvenating for all of our bodies. When we don't sleep well, our mood, concentration, and emotional balance all suffer. Over time, poor sleep can raise the risk of anxiety, depression, and even lead to poor physical health with increased risk of obesity, high blood pressure, heart disease, or diabetes. So what's the good news? Well, there are proven practical steps called sleep hygiene that can make a real difference. If you follow them strictly for just a fortnight, most people will see significant improvements in their quality and quantity of sleep. We know that sleep problems can become long-term and problematic when they are maintained by thoughts, habits and routines that may have initially started as a way to cope with not being able to sleep, but then become ingrained and interfere with and disrupt our body's natural rhythm. Research from ICBT programs show that improving sleep hygiene alone can lead to improved sleep with reduced sleep difficulties by up to 40%. By getting you back into a circadian, sleep-friendly rhythm. And when combined with cognitive strategies to calm the mental noise and unhelpful self-chatter, the results are even better. So let's go through the key steps. First, keep a consistent schedule. The most important thing is to decide on what your getting up time is going to be. So that's the time you get up and get out of bed. Place a loud alarm clock on the other side of the room if you need to, and stick with it. Count back 7 to 8 hours and then do not go to bed before then, even on weekends. Consistency trains your brain to expect sleep at predictable times. Second, create a wind down routine. Spend the last 1 hour to half an hour before bed doing something calming like reading, stretching, taking a bath, not a shower, or listening to soft music. Research in ICBT shows that cutting screen time before bed reduces mental arousal and helps people fall asleep faster. Third, optimize your sleep environment. Keep your room dark, quiet and cool. Around 18 degrees is ideal. Remove bright lights and distractions and reserve your bed for sleep and intimacy only. This builds a strong link between bed and sleep, what CBTI calls stimulus control. Fourth, watch what you consume. Avoid caffeine after mid-afternoon. Avoid alcohol altogether because it tends to harm your sleep architecture, and skip heavy meals right before bed. Fifth, be smart about naps. Ideally, no napping, as this confuses your sleep-wake cycle. If you find yourself lying awake in bed for more than 15 to 20 minutes, then get up, leave the bedroom and go and do something relaxing. Return to bed when you feel sleepy again. You may need to do this repeatedly to begin with, and that's okay. It's totally normal. That simple change helps to break the frustration-wakefulness loop. Good sleep hygiene is simple, but not always easy to consistently stick to, especially when stress or mental health issues are involved. If you've tried these steps and still struggle, then ICBT programs are available online, or a conversation with your clinician can help to see what else might be going on and recommend alternative strategies. So remember, improved sleep isn't just about feeling rested, it's about protecting your mood, your mind and your body. I'm Dr. Vicky Cleak, and I hope tonight you give yourself permission to rest well. Good night and take care of your sleep.